If your front desk spends 3 to 5 hours every week calling patients who are overdue for a visit and still loses most of them to voicemail, there's a better way. In the next 10 minutes, I'll walk you through an automation that finds every overdue patient in your practice, reaches them across text, email, and a phone call, and books them back into the schedule, without changing your EHR and without adding a single staff hour. How to automate patient recall in a medical or dental practice without changing your EHR. Patient recall is the work nobody schedules and everybody resents. A staff member pulls a list of patients overdue for an annual physical, a 6-month cleaning, a follow-up, or a chronic care check-in, and starts dialing. Most calls go to voicemail. The ones that connect take 5 to 10 minutes each. By the time the list is done, a week has passed and another batch is already overdue. The cost adds up faster than most owners realize. 3 to 5 staff hours a week is one number. The harder number is the visits that never happen. The annual physicals that quietly slip a year, the dental hygiene appointments that get postponed indefinitely, the diabetics who don't come back for their A1C, the post-op patients who never get their 2-week follow-up. Each of those is a revenue line you've already earned and just aren't collecting. And clinically, it's the patients you most need to see who are most likely to fall off the list. The good news, every step of this work is a pattern. And patterns are what automation is good at. A patient recall automation has 3 jobs. 1, find every patient who is overdue on the right cadence for the right reason. 2, reach them across the channels they actually respond on. Text first, email second, a voice call only if the first 2 are ignored. 3, book the visit back into your schedule with as little friction as possible. Ideally, a link they tap once. The piece most practices try to skip is the escalation logic. A single text blast gets a 15% response on a good day. A 3-step sequence, text, then email, then a voice call 2 days later, clears half the list or more. The automation is what makes that escalation reliable, because no human is going to remember which patient is on day 3 of which sequence. Let's build it. The tool I'm using is N8N. It's a low-code automation platform you can self-host on infrastructure covered by a business associate agreement, which is the right fit for anything touching patient data. The same shape of workflow works in Zapier or Make if your practice is already on those, but N8N is what I recommend for healthcare because of the HIPAA path. The actual AWS setup with a BAA is its own topic. I cover it in the companion video on this channel, link in the description, so I won't repeat the infrastructure piece here. I'll start with the trigger, the node that decides who counts as overdue today. A schedule trigger fires every morning and reads your patient list. That list is usually an export from your EHR or your practice management system. Most systems can drop a daily CSV into a folder or expose a report through an API. You're not modifying the EHR, you're reading from it. That's an important distinction, both for IT and for compliance. Then a filter pulls anyone whose last visit was more than a defined window ago. 12 months for an annual physical, 3 months for a diabetes follow-up, 2 weeks for a post-op. Here, 10 patients narrow to the 6 who are actually overdue. Now the outreach. For each patient on that list, the automation kicks off a sequence. Day 1, a text message. Short, friendly, includes the booking link, never includes any clinical detail. Day 3, if they haven't booked, an email with the same booking link and a slightly fuller explanation. Day 5, if there's still no booking, a voice call. That call can be a live staff member or, and this is where AI starts to earn its keep, a voice agent that introduces itself, says the practice is calling to help them get on the schedule, and offers to text the link right then. Every step is gated. Between each message is a wait and a check. The moment a booking comes back, this branch fires and the patient drops out of the sequence, so no one who's already booked still gets a call. 2 compliance notes that matter here. First, the message body should not contain protected health information. No diagnosis, no test result, no medication. It's time for your annual visit is fine. It's time for your diabetes follow-up is not. Second, whichever vendor you use for the text, email, or voice piece needs to sign a business associate agreement with your practice. There's a separate video coming on the HIPAA side of this. For now, just know the rule. The third job is booking. The link in every message points to a booking page that shows only the slots appropriate for that visit type. The patient picks a time, confirms, and the appointment lands on your schedule the same way a phone-booked appointment would. The automation sees the booking event come back, marks the patient as handled, and stops the sequence. So nobody gets a voicemail the day after they've already booked. That last detail is what makes the system feel competent instead of robotic. The patient experience should be one message, one tap, done. Notice what we didn't do. We didn't replace your EHR. We didn't ask your staff to learn a new charting system. The automation sits next to your existing setup. It reads from it, it writes appointments back to it, and that's the whole footprint. What a practice should expect conservatively in the first 90 days. Staff hours on recall drop to under 1 a week. Most of that is review, not dialing. Response rates roughly triple because you're meeting people on the channel they actually use. And you'll recover visits that have been sitting on the overdue list for 6 months or more. The kind of recovery that pays for the automation many times over in its first quarter. So that's the build. Find overdue patients on a schedule, reach them across text, email, and a voice call in that order, and book them back in with a one-tap link without touching your EHR. I've put the full workflow template for this build, the trigger, the sequence, the compliance notes, into a free download. The link is in the description. Grab it, and you have everything you need to brief your team or your IT person. If you'd rather have it set up for your practice instead of building it yourself, you can book a working session on the same page. Either way, subscribe. The next video breaks down the N8N setup itself, including the HIPAA-safe hosting that makes this safe for real patient data. It pairs directly with this one. See you there.